Long before the first human-to-human heart transplant performed by Christiaan Barnard, there had to be a development in the field of immunology, which led to attempts at transplantation. When advancing in the field of transplantation and improving and creating certain techniques, surgeons began transplanting organs in the lab as research. The beginning of human transplantation started in 1954, starting with the kidney transplant, which then followed with pancreas transplant, liver transplants, and other essential organs. With the transplantation followed the discovery of rejection in transplanted organs. Rejection occurred because the immune system recognizes a new organ in the same way it recognizes viruses, and the body's natural instinct is to attack the invader. In the 1960s, it was discovered that some anti-cancer drugs suppress the immune system, assisting in a longer and healthier life for the transplant recipient, and also lowers the risk of rejection. Keith Rimster showed that immune suppressive agents would prolong the heart transplant survival in a lab setting.
Christiaan Barnard, born in 1922, was a medical pioneer for South Africa. Christiaan introduced open cardiopulmonary bypass surgery, developed a new design for artificial heart valves. Barnard was the first to show that intestinal atresia is caused by an insufficient blood supply to the fetus during pregnancy. This discovery led to the development of a surgical procedure to correct the fatal defect in pregnant women. Even with countless medical advances that Christiaan Barnard introduced to South Africa, he still continued on to experiment heart transplantation on animals and perform the first kidney transplant in South Africa so that he could become accustomed to how anti-rejection treatment works. Surgeons worldwide followed Barnard's lead, and by October 1971, there were about 178 numbered heart transplants. On December 2, 1967, a young woman, Denise Darvall, was pronounced brain dead from a tragic accident. Shortly beforehand, Barnard had been introduced to Louis Washkansky, a 50-year-old man suffering from coronary artery disease. Barnard believed he was prepared to take on the challenge of a heart transplant in that moment. Leading up to the operation, Christiaan Barnard and his group of heart specialists administered large amounts of medication into Washkansky to trick the body into accepting his new organ. Denise Darvall's donor heart was kept beating in a heart-lung machine. His machine also circulated Louis Washkansky's blood until his heart was able to be replaced with the donor's. This procedure was performed on December 3, 1967, and lasted 48 extensive hours.
You understand?
Yes, I understand that. It's difficult to make predictions and prognosis if you've not had previous experience.
Yes.
But I would say that I'm sure that he is going to live longer than he would have lived without the operation. I can't say how many months or how many years.
Louis Washkansky survived 19 days after his operation. He passed from pneumonia, which was a result of his medications he was given to reduce the risk of rejection. The medication made the body unable to defend itself from infections, also known as immunosuppressants.
It was really heartbreaking at autopsy to see how beautiful this heart looked. It was normal in size. The suture lines were all intact without any evidence of infection or clotting inside the heart. And it was really a great disappointment for us to see that he died of pneumonia, and the heart that we really treated him for was...
This procedure was a big deal in medical history because it influenced other medical fields to advance in many different areas such as medication, surgery, and transplantation. This procedure influenced more attempts at heart transplants and improvements on transplant techniques. Today in history, we have completed the first successful face transplant, and many more after that.
To become Mayo Clinic's first face transplant patient.
At the time of the transplant, we had 9 surgeons operating. We used over 40 operating room staff, scrub nurses, circulating nurses, perfusionists, and so on.
The operation took nearly...
These advancements stem from kidney transplant, which led to liver, pancreas, and heart transplants.
But the unthinkable had been done, and since then, more than 500 successful heart transplants have been performed at Groote Schuur Hospital.
I'm very grateful that I was able to live another 30 years after the first transplant, and also I'm very grateful that I was able to see the advances made in this field and